Introduce Dr. Priyanka Gupta. She is a part of our wellness team here at Kawartha Care Wellness Center, and she's been working virtually with us for almost a year now as our naturopathic doctor on site. She has been doing all of our virtual calls simply because of COVID and the safety reasons that way, and obviously doing a great job with that. And one of the topics that we came across that a lot of people are unfortunately experiencing right now are obviously a lot of mental health conditions. So the anxiety, the depression, a slew of other things that have obviously gone on the uprise with COVID and with several lockdowns. But second to that, we've also noticed that sleep has been affected. And often people say, is it the anxiety that's causing the sleep deprivation or the insomnia? Or is it the insomnia that's causing the anxiety? Chicken and the egg. So today, I'd like to introduce Dr. Gupta, and she'll talk a little bit more about this and provide some solutions that she can foresee as research as a naturopathic doctor. Again, thanks for joining us, and thanks, Dr. Gupta, for taking on this webinar and teaching us a little bit more. If you do have questions, please feel free to go to the Q&A. We will be answering questions at the end of the webinar. You can also go to the chat and you can ask some questions there as well. So without further ado, I will let you get started.
Great. Thank you so much for that lovely introduction. So, when I was asked to do a little webinar this month, I thought, what would be a great topic? And definitely this was an idea that was presented, and I like that. And for sure, there is a connection between sleep and anxiety, and, they definitely affect each other. So we'll talk about that and some natural solutions for sleep. So if I can have the first slide. So definitely there's a connection. So, if somebody doesn't get enough sleep or restful sleep, they can definitely exacerbate any anxiety or any anxious feelings. We need deep sleep or deep REM sleep for different processes. Our brains go into a period of rest. We need that as an anti-inflammatory for our brain. So trying to get deep sleep, REM sleep, is great for learning, for mood, for memory. And if you're not getting enough good sleep, then all these things will be definitely affected. And then anxiety can also have an effect on sleep. So if you are anxious or if you have feelings of anxiety, obviously you can experience sleeplessness. So they go hand in hand. And also I'm going to talk about some underlying conditions that could be affecting sleep other than anxiety. For example, we'll talk about hormones or digestion. There are other factors that could actually be causing some sleep disturbances, which are key to address. And then also I'll talk about some natural and some lifestyle solutions. So if I can have the next, so when we talk about sleep hygiene, I'm sure everybody has heard that, we need to sleep in a dark room, and that is for optimal melatonin production. So the best melatonin really is the melatonin you produce yourself, rather than, taking it in a supplement form, although there is benefits of taking high dose melatonin that research is finding. But trying to regulate your sleep-wake cycle naturally is going to be the best way for you to increase your melatonin stores. And if you see the graph, it is natural that around 10, 11 o'clock that your body will start to produce melatonin from the pineal gland, which is between your eyes. So which is important. The reason why it's situated between the eyes is because you kind of want to close your eyes, and that kind of stimulates the melatonin production naturally. So, if you can't be in a completely dark room, wearing an eye mask is important, or a eye cover can definitely help. But getting that being in a dark room is one of the best ways to improve your melatonin stores. So also in the graph, you can see over the course of the night, your melatonin will be highest in the middle of the night, and then will start to drop off as you are going to be waking. And as much as possible, if we can kind of keep a routine. I think routine is so important, not only for melatonin levels, but also for cortisol production, which I'll talk a little bit about, our stress hormone. So maintaining, similar times when you go to sleep at night, having a ritual, if you will, if you have tea or like a a sleep aid or something like that, having the routine at the similar time every night is definitely going to be very good for your body, instead of having an erratic routine. I know for new moms, I know that is definitely definitely difficult, but the body is great in time in recovering that after a period of disruption. We can definitely get back to a routine as much as possible, and that's always great for sleep. The other benefits of melatonin, it's been shown that melatonin can help people with premenstrual disorder or premenstrual pain, dysmenorrhea. It can also help to delay the aging process. It's something that over time may decrease, so it can work as an antioxidant, so it can help to delay the aging process. Studies have shown that it can reduce the risk of diabetes, and it can also help with migraine. So there are lots of benefits of taking melatonin, but I definitely encourage people to try other natural lifestyle solutions before they have to take the supplement. Also, cell phone and computer use. I know, I don't know what type of syndrome it was called, where moms would, they'll use that time when the kids are asleep and try to get all the work done, or, force themselves to stay up and overuse the computer or cell phone. That's something that obviously, because of the light from the device, will diminish the natural production of melatonin, or delay it, if you will. So it's not recommended, but I know most of us are guilty of that. But that's something that is, that we should be aware of if we're having major sleep issues, that, try to get all the work done beforehand and try to make a hard stop maybe at 9 o'clock, rather than prolonging or using the devices for a long period of time. So if can I have the next slide? Yeah. Okay. And another thing that I want to talk about is caffeine. So definitely people are using caffeine more. I'm finding to try to, stay up or be alert. And it can be a vicious cycle where you're using caffeine and then you are not able to sleep. So then you have to redose the caffeine in the next morning. You want to have caffeine earlier in the day if possible. And I always think that coffee is kind of like a drug that we just naturally accept, in our society, that it's okay to use. But I find that, especially for women who have something called estrogen dominance, or who are experiencing a lot of hormonal disruption, coffee can be something that, if you can reduce or you can try and replace, there's better outcomes. So your hormones will like you better if you can, decrease your coffee intake, and your liver will love you better. So I definitely try to suggest that. I know that's not always easy, but there are some other great alternatives, such as obviously green tea. There are other coffee replacements, if you will, that are better for you. And I also talked a little bit about maintaining a routine. And one of the things I do is hormone testing. I do something called the Dutch test. And in the Dutch test, we look for cortisol levels. And cortisol is one of your stress hormones. So if you have resistant weight loss, or if you have different types of hormonal issues, cortisol can be a factor in that. And one of the best ways to regulate or reduce your cortisol, your stress levels, is maintaining a routine. So eating at a similar time every day, doing a ritual, if you will, reading something, or calming down, or going to bed at the same time every night. Routine is definitely something that our body likes. So that's something to remember. And as I said, it can definitely affect other hormones as well, the cortisol. So we can have the next slide. Another important factor for sleep hygiene is regulating blood sugar. If you are consuming lots of sweets, or if you're not able to kind of control your cravings, I definitely find in clinical practice that really affects your sleep. It actually affects my sleep when I tend to eat too much, or I sugar, or if I'm not controlling my blood sugar properly. I definitely find that it affects my sleep, and it definitely affects how tired I am in the morning. So what you do during the day obviously will have an effect on what outcome you have at nighttime. So some of the symptoms of blood sugar dysregulation can be frequent urination, and obviously this can be also coupled with, increased thirst. So people who are getting up at night a lot, although there's definitely a lot of different reasons for frequent urination, it's not only blood sugar control, but that's something to keep in mind, that you really want to have a healthy diet, low in sugar, and high in protein, to try and reduce the impact of blood sugar on your sleep and how you're functioning. Obviously, regular exercise will be great. Any type of walking, any type of yoga, that's recommended for better sleep. And as I mentioned, protein or increasing protein. It's interesting. I'm seeing a lot of women with, turning to, being vegan, or turning, to different types of diets, which I really appreciate in terms of, the ethics behind it. But I definitely encourage all women to focus on protein. I think protein is so important for maintaining healthy weight, and also offsetting the effects of, if you have any kind of sugar cravings, it definitely helps to improve your protein levels. So if we can go on. Yeah. Okay, so some natural solutions. So right off the bat, some of the solutions that I like to turn to would be valerian root. So you could consume that in a tea. Valerian root is so common. It can also be found in different types of sleep aids. So it's very calming, and it has a similar effect as the way that benzodiazepines work. So it's, as I said, it's very calming. So if you have anxiety as well, this is something that you can also reach for. It's very soothing, and it helps with anxiety. So it can cause a little bit of drowsiness, but taking it before bedtime, it is favorable. Another herb that I didn't include here is called passion flower. So I use passion flower tincture a lot for, I find that it works well with both men and women, a little bit better in men for whatever reason, but definitely a passion flower tincture is something that I prescribe. I have it made up, and I prescribe that. So that tends to really help. Another herb is kava root, and that's also very calming. Again, some of these things are crossed over between sleep and anxiety. So kava root, you can take it as a supplement. And although the method of action is not certain, it seems to work similar to the valerian root, as benzodiazepines work, calming the brain function. So those are two natural solutions. Another one is magnesium. And I find for most women, I would say magnesium is a must in their supplement regime. It is very helpful for stress, as also anxiety. There are multiple uses of magnesium also you can appreciate. So for restless legs, any kind of pain and inflammation, it seems to be just a good supplement to add to your regime. And it also comes in different forms. So for example, it could come in citrate form, it could come in biglycinate form. So depending on what your main area of concern is, I would recommend the form. Biglycinate or bisglycinate, sorry, tends to cross the blood-brain barrier a little bit more, so it can be helpful more for anxiety, whereas citrate or chloride, that tends to be a little bit more for physical pain or constipation. And so this product here, although I'm not endorsing it, but it definitely, you could do like a drink. You could do like a magnesium, kind of like a citrate drink before you go to sleep. And it's something that's very calming and soothing, and as a natural sleep aid. Okay, so another solution that I would like to highlight is acupuncture. And this has been studied clinically for the use of chronic pain. I use it in my practice, but it's very good for signaling the nerves receptors to kind of, calm down, and just uses, the thing with acupuncture is that we're really not sure how it works, but it's just so effective and regulating sleep-wake cycles, and also anxiety, and also pain. So I put that in there. I think that it's underutilized, definitely for sleep. People really don't realize that it can have such a powerful effect on sleep. But regular acupuncture, so maybe something like weekly for 10 weeks, is something that definitely I would recommend for somebody who has anxiety or sleep issues. Okay, and then sleep is also something that's interesting. It can also be a symptom of, or insomnia can also be a symptom of something else that's going on in the body. So you want to look at your digestion for sure. It could be that, heartburn is keeping you up at night, or gas and bloating, or other types of digestive concerns that can be actually causing your insomnia. So as a naturopath, that's what I do. I like to look at what can be the root cause, not just treat the symptoms. So if somebody says they have sleep issues, it's not just, oh, take some melatonin or take some tea. It's, looking into, when did this issue start? What could be linked to the sleep disorder? I definitely look very deep into somebody's digestion and how they're digesting their food. And something that I'm seeing often in my practice is called SIBO, and this is called small intestinal bacterial overgrowth syndrome. And this is interesting, where it can be the answer to a lot of individuals' IBS. So when you get a diagnosis of IBS, it can be just like a general type of like a label where we're not sure why you're getting certain symptoms, but it's just kind of looped into all in a broader category of IBS. But in SIBO, it can be the answer to why somebody might have some digestive issues. It's where pathogenic bacteria are actually displaced and they grow in the small intestine, where you shouldn't have any bacterial growth. So this is something that I test for. It's a simple hydrogen test. It's a breath test. It's a home kit, and it gives us indications as to what are the different bacteria, or what, if it is SIBO, what is the pathogenic bacteria that is at play here. So there is methane or hydrogen producing bacteria. Without going into too much detail, treating SIBO can be very effective for digestive concerns, and therefore may help you also sleep better, or get better sleep if this is your area of concern. And then also hormones. So I see a lot of hormonal menopausal women or perimenopausal women where sleep starts to become disrupted. So obviously diet is a major factor that we try to look at and try to clean up as much as possible. But also, using the Dutch test, we see if there are different hormones that are at play. And by, supporting, or by, supporting different metabolic pathways, we can actually augment hormones or get a better hormone profile, thereby reducing hot flashes. Some of the treatments that I do are topical estrogen progesterone cream, especially progesterone, that really tends to help hormones. And then I talked a little bit about estrogen dominance. So these are the things that I do. I look at hormones and seeing if that's actually at play for your anxiety and sleep. And so those are some of the things that I do in terms of investigating what could be a possible link to your sleep and anxiety. And then lastly, I have some lifestyle factors for better sleep. It's not a cliche, but definitely meditation is something that has been talked about a lot in terms of anxiety and sleep. So, having a period of time carved out for you where, it could be as simple as 10, 15 minutes, even in the morning, where you would, usually focus on your breath, or you would use a mantra, if you will, and there's so many different apps nowadays. There's so many different, venues or avenues where you can actually learn how to meditate. I think that's, it's a little time that you take for yourself, because to be honest, if you have stress in your life, you may not be able to solve that stress, but you can obviously approach it in a different way. And that's what meditation and centering offers you, where you cannot maybe, physically, do anything about, the stress that you have in your life, but you can approach it in a more centered and calming manner. And, and that definitely has a great effect, especially for myself. I find that when I do take a little bit of time to center and do a little meditation in the morning, I can be more calm and, approach my kids in a more positive manner. Of course, there are lots of triggers during the daytime. So always remembering that focus is always important. So breathing exercises as well. So if you're in the brunt of some stressful situations, there's also different breathing exercises and techniques that can help to kind of center and to remember the breath. So that's always available. Some essential oils have also been studied or suggested for better sleep and anxiety, such as lavender and lemon balm. You could use it in different manners in terms of a diffuser. That's also something that can be very calming or part of your sleep routine. And spirituality, I think that definitely has a place in the realm of anxiety, to understand that we are a part of a bigger picture. We are citizens of global citizens, if you will, and always thinking that your issue is obviously it's a major issue if you have one, but in the grand scheme of things, I always think about placing some importance in spirituality, and thinking of yourself as a part of a community, and anyway, that really does help me for sure. And also volunteerism, I do recommend that to a lot of my patients, although now it's definitely difficult to take part in volunteering, in going somewhere and volunteering. But I always find that helping someone else that's in need can be definitely something that will take the focus off of your own stress or your own anxiety, and it definitely has positive benefits, having compassion and doing volunteer work for myself. And I like to always give that tip to my patients. And lastly, of course, exercise. I think it's great that people are now taking the time to go outside more and hike, with your family, or just be a part of nature. This is something that is overlooked, but it's something that we should try to do every day if we can. Just go for a walk and try to enjoy the springtime. We're having amazing weather, so why not take advantage of that? It's free, and it's something that that definitely can make a difference in somebody's mood and anxiety. So that's also something that I recommend. So yes, if you have any questions, you can always reach me, and I'll hand it over to you.
Yeah, thank you so much. That was awesome. I actually learned quite a bit. And I know we always think about certain medications or sort of things that are supplements, but I think kind of deep diving further into what you said, things like, the gas, the bloating, the SIBO test, all those things that we're not really aware of, because obviously that's not our field of expertise, that's yours. I think that's always handy to have like a deep dive before just jumping into the supplements blindly, right? So we do have a question before we go on and just end the webinar, and I'll just pull that up. So we have a question here that says, hi there, what is the recommended dose of magnesium?
So that really depends on the form of magnesium. It's not a simple answer, really, that I can definitely recommend. For example, for bone health, 500 milligrams of magnesium citrate is something that's recommended. For the bisglycinate, you could do anywhere from 250 milligrams to 500 milligrams. So it's not a simple answer, but I would say that for in terms of the calm magnesium, what I recommend, I know from my past patients, that I recommend 1 to 2 teaspoons of the calm magnesium for sleep. That's something that I do recommend. But again, for magnesium, it varies in terms of the other supplements you're taking, and also the form and what form is actually recommended for you. So, yeah.
So it would be fair to say maybe just to touch base with yourself, just to further investigate. Just like any other medication someone's taking, it's not like a one size fits all.
Yes, exactly, yeah.
Is there any other questions that anyone does have? They can type it into the Q&A. I think we have another one here. Do you recommend magnesium / melatonin combined?
Sometimes I have people take melatonin, and I have people take individuals take magnesium. I don't know of any product like that is combined per se, but yes, you could definitely take melatonin and you could take magnesium, of course, with the guidance of somebody. I don't want to make a blanket statement, but definitely you that is something that I have done in the past. Yeah.
Any other questions? Oh, I have one more. Does magnesium deficiency show up in blood tests or in a regular blood panel? Could you request for that?
You could, but magnesium is a little bit tricky. Again, there's so many different forms. The form that's in your blood work may not translate to the accurate amount that you actually need. Magnesium is so important for so many different processes for the muscles. It's actually located in various different tissues. So a regular blood test may not test for it, but I do have a test that I run for magnesium, but it's not something like a regular CBC analysis or something like that. It's something more sophisticated that we can run for, and yeah, so it's something that we can test for sure. Yeah.
Any other questions? One more here, I believe. Okay, I started taking zinc and magnesium and calcium. Does that help with sleep?
So again, it depends on the form. If it's coupled with your calcium, then the magnesium is there for the absorption of the calcium for your bone health. Magnesium, again, on itself, that is more recommended for sleep and for anxiety and things like that. Again, I'd have to see the form, I'd have to see the product, but it can help. But magnesium, again, it serves so many different purposes. In that product, it could be just there to aid in calcium absorption, and you may need to take something on its own, but always better to look into it with a healthcare practitioner to be safe. But yes, you could take something in addition to. But again, I don't want to just give any medical advice, but you'd have to look at it by case basis. Yeah.
Did you say that you put together something that includes various roots of products or roots of something?
Yes, I think I was alluding to the passion flower tincture. That is something that I compound. I have compounded at a pharmacy, and so that's something that is dose dependent, and I'd have to take a case, and so that if you're a good candidate for that, I would prescribe that for you, and that's something that's very soothing, very calming, and it definitely helps for sleep. But again, with an intake, I can definitely assess if this is something that you would need. And it's interesting because there's so many things for sleep. When you talk to somebody who has this experience, then you can understand. Then it kind of mitigates having to try different things, or the person can actually tell you, okay, this is something that would probably likely be the best suited for you, and so why don't we go with this, or why don't we start with something of this caliber? Yeah.
Magnesium is just one example that you provided, but there's several other sort of options that are out there as well.
Mm-hmm.
Okay, so one more question here. Lots of good questions, so keep them coming. I have been having a hard time sleeping without alcohol use. What are your thoughts on alcohol as a sleep aid?
Well, that's for that type of a scenario, we have to go back and dive a little bit deeper as to why this is. Definitely, it wouldn't be recommended. As a statement, it's not really recommended because chronic alcohol use does have other types of repercussions. But how we got here, or how is it that that this is kind of come about, we'd have to investigate and see if there's better solutions, or a better way to kind of have achieve sleep. I think that's definitely important. But typically speaking, that isn't something that I would recommend. Yeah.
Just a comment. Good job and great advice. All right. If there's any more questions, feel free to put them in the Q&A, and we'll wrap that up. Oh, just one more. Sorry. What type of appointment should I book for a 19-year-old who is suffering from sleep and anxiety? So I can maybe help answer that if that's okay with you. So basically, what you'd want to do is go to our website, which is kawarthacare.com, and that's right on the screen right now. You would click book now and go to naturopaths, and then you would see Dr. Gupta's face pop up there, and you would book a full initial, which is the full appointment, and you would do the intake forms and so on and so forth. If you wanted to book a consult, which is a 15-minute complimentary, just to get into more information before you book the initial appointment, then you would go ahead and book the complimentary discovery call, which is 15 minutes. And everything is online right now because of COVID. So the appointment would be done online with Dr. Gupta at the time that you've booked in. So again, going to the website, going to book now, and then you'll see naturopath, and then you can book either the initial or the complimentary consult, however you'd like to go and proceed with that. If you do have any questions or that seems a little bit confusing, we can also call in to book at the phone number that's below, which is 705-878-8558. All of these appointments are covered usually through your extended health benefits, and we can direct bill for that as well. And just to highlight there for anybody else who has any questions or concerns, if you're not sure if this is something that would be helpful for you, you want to deep dive a little bit further before booking your initial, you are welcome to book the complimentary discovery. That's always available for any of our services. I do have a couple more questions if that's okay with you. Yeah, okay. It says, if it's online, I guess you cannot do the test to see what roots, etc. they would need. So the nice thing, and again, you can talk about this as well, is that because everything is virtual and a lot of the naturopaths have, moved their practices online, you still can get referrals for blood work. And that would be still done through Life Labs and get the information there. I believe all of the tinctures and the homeopathic supplements and supplements in general can be mailed directly to your house as well. So maybe you can speak a little bit towards that, because sometimes that's a little confusing.
Yeah, I mean, all the testing is basically done, I can basically give any kind of a requisition online. So that's one thing. If you need any kind of testing, like the Dutch test, basically a lot of companies now just drop ship them for me. So they just come to your office, you come to your home, and you see, in the case of the Dutch test, it's a urine analysis or urine test that gets mailed back to the company, and then the lab will give me the results. So testing is something that is pretty seamless. It's not there's no problem with doing virtual and having testing done. That's fine. Yeah.
And what about supplements and all that? Sort of anything that's prescribed, would that be able to be accessible to patients as well?
Yes, so I use a portal called FullScript, and so you just I would put the prescription into the portal. It's kind of like Amazon, but for professional products. These are products that you won't be able to get per se at a health food store, but these are professional line products that are relatively more effective, so they kind of require a professional to prescribe them. And so I use this portal called FullScript, and the prescription just comes to you, and you can just order that, and you can start with your supplements. There are some homeopathic remedies that are not available, and so I do mail them out to you as a service, because I am very vested in the well-being of my patients, and I want them to get better. So I have my own pharmacy, really, and I mail out the remedies from that. So that's how I do that.
Perfect. So we're just going to wrap up now. Thank you so much. There's a lot of questions, and a lot of great questions that I think would benefit everybody who was participating in the webinar. I'd like to thank you, Dr. Gupta, for conducting it. As always, good information. So I appreciate that. If there's anything else, again, you can call the office, you can email us, or you can book online. And again, thank you so much for joining us. If there's anything else, feel free. We'll just be on for another minute or so to wrap up. So thanks, everyone. Hope you have a good lunch break and a great long weekend.